I was taken on in Trinity in 2011 to deliver Stop Smoking and other programmes. My role was based in College Health Service. While working with people who were trying to quit smoking, I kept hearing the same thing. People were killing themselves to stop smoking, but walking in and out of buildings was really hard because they had to walk through a plume of smoke. My line manager, the director of the College Health Service, and I were talking about the tobacco-free campus movement. It was emerging in the US at the time, and we got wind that the registrar, who's the most senior academic in Trinity, was interested in tobacco-free campuses too. So we contacted her and pulled together a preliminary group to see if Trinity could become tobacco-free. I was really excited to go to the first meeting because it felt like an opportunity to do more kind of pure health promotion than, say, just programmatic. I know programmatic health promotion has small but significant effects, and we will always do programmatic health promotion, but I had moved to Trinity because I wanted to do settings-based health promotion. At the preliminary meeting was the Registrar of Trinity, the Director of the Health Service, I think there was a Professor of Population Health, the Secretary to the Board, the Chair of the Group of Unions, the College Safety Officer, the President of TCDSU, and there was a representative from the dental school. To be honest, I was quite intimidated, but I put the head down and pretended I wasn't. The Registrar took on an action from the meeting to get permission from the Board of Trinity to do a consultation, because at that stage we weren't sure was this either feasible or acceptable. So she tried to get us permission to do that. We got the permission from Board and we did a year-long consultation. During that consultation we had over 10,000 engagements. We did that through surveys, town hall meetings, focus groups. And at the end of the consultation we had very strong support from staff and postgrads to become tobacco-free, but only marginal majority support from undergrads in our surveys. At the same time, TCDSU had voted against becoming tobacco-free in a plebiscite that they had held. So we were at a stalemate where the institution wanted it, but TCDSU had some reservations. So we made two proposals to Board to become tobacco-free. Unfortunately, the first was refused, but the second was accepted. It was a proposal to trial pilot tobacco-free zones. We picked the three areas where there was most complaints about smoking at entrances and took baseline data on observed smoking. Then we installed signs in the zones and created multiple communication campaigns to encourage compliance with the zones. Really importantly, we employed students to count the smokers in the zones to remind people that they were requested not to smoke there. After our pilot, we had shown an 83% reduction observed smoking in the zones. Based on that, TCDSU held another vote and we got 71 support for becoming a tobacco-free campus. I acted as secretary and project manager to the project. During the consultation phase, there was a question about how will we run this. I gathered the opinions of partners across college verbally, then I did the literature review, though there was scant literature. Basically, I proposed we base our approach to the consultation on the University of Michigan's approach, and we had a guidance document from the US that was based on grey literature rather than high quality peer-reviewed data, where we would have been much more comfortable. I did the legwork on the consultation. I organised meeting rooms, analysed data, drafted reports. The committee members reviewed documents, spoke at high-level meetings and gatherings, offered guidance on strategy, influenced their constituencies. So, for example, different people have different meetings. So they went to their senior management meetings or the service management or the union meetings, and they added tobacco-free Trinity to the agenda. One of my jobs was to organise 4 town hall meetings about becoming tobacco-free. At every meeting we took a vote by show of hands, and a majority of people said it was acceptable for Trinity to become tobacco-free, but it really wasn't very clear on how feasible it was, and people were unsure about that. Basically, people didn't think a tobacco-free campus could be implemented. At one of our town hall meetings, a person who seemed quite angry said something like, well, of course health supports this, but there are lots of people who don't. And that was true. The Director of the Health Service took the proposal to the health-related meetings he was attending, and health was generally very supportive, though they too questioned, how are you going to actually implement a tobacco-free campus? Students were worried about the 24-hour library. People who organise our conferences and our banquets were worried about where people were going to go. And of course we have over 400 beds on campus. There was also the issue of staff who would have to walk a long way to take cigarette breaks, and of course the small matter of we have 1 million people who visit the Book of Kells each year. Once we'd gathered the difficult questions, my role was to organise focus groups to resolve them. The focus groups were chaired by senior staff members. My role then was to gather all of that information that we took that year and draft it into a proposal. The committee reviewed it and we took it to board. Once it had been rejected, I worked with the registrar and the director of college health to manage the relationship with TCDSU and GSU, the Graduate Students' Union, to negotiate alternative proposals. When we got approval to put in tobacco-free zones, I worked with the estates and facilities to get signs and shelters installed, and communications and student ambassadors to launch campaigns. I also devised the Living Lab approach, with consultation from the committee, of course, for how we could count smokers by employing smoke-free ambassadors who upload counts of observed smokers every week. So every week we have students who walk the campus and count our smokers. After 4 years and showing a 79% reduction in smoking, I was then lead author on a Living Lab paper documenting the process of implementing a tobacco-free campus. And that's been useful in terms of bringing it to management and saying, oh look, we have this published paper that captured the whole thing, and it kind of gives us legitimacy and it gets the attention of management, and it's really what a university should do. And of course, having a national smoking policy that was aiming to get to a prevalence of 5% was a huge help. Another thing that helped was having prevalence data. In fact, it was essential. Knowing that only 8% of our population smoke daily really empowered us. Other institutions say, well, we'd have higher prevalence than that. But actually, national daily smoking prevalence is only 18%. So all HEIs likely have smoking of less than that. Whilst there were vociferous narratives against becoming tobacco-free, a majority of people were in favour of becoming a tobacco-free campus. It was really useful to have the voices of people from across the university. For example, people who clean the cigarette butts up. They talk about the scourge of cigarette butts on cobblestones. And people who couldn't open their windows, for example, because of the smoke rising up. That was a useful voice. It was useful to have the voices of people in health also, who were dealing in the health services with, for example, people who turn up with a cold that's lingered for weeks. So those voices were all really, really useful. Another thing that's really helped is student engagement. Having students at the centre of Tobacco-Free Trinity has really been invaluable. Our ambassadors are an essential resource to the project. They're a form of champion, really, and champions are, we've used champion-based model throughout the project. So we got lots of students who wanted, for example, to engage with the project through their curriculum. And by allowing them to use the campus as a learning tool, we benefited. Some of the ways we did that was that we had different student campaigns. People wanted to use the on-campus screens, wanted to use our social media. There were students who wanted to install smoking voting bins where you could vote for, you could dispose of your cigarettes as a vote. The TCDSU ran a comedy debate for us. The House Would Smoke Outside the Arts Building was the title of that. We had competitions where count the number of cigarette butts in the vase. We had cigarette-shaped piñatas where people could bang away at the piñata to win a Trinity Ball ticket. So we had lots of different novel ideas that came to us via students, and that really helped with the project. Certainly, we have an issue of non-compliance. So in Trinity, our observed smoking is always about one person per circuit. So I mentioned that we have students who walk the campus. They'll always see at least, on average, one person. So smoking is still very visible on campus. Another difficulty we had was trying to decide between enforcement versus requesting compliance. So we went down a rabbit hole of should we have fines, should we just ask? And in the end, what we decided was that it was better to just request compliance. We're all adults. We're not forcing anybody to do anything. We just ask people, would they mind moving out of respect for the will, for the kind of consensus that the community has come to. And of course, the vaping, I mean, some of the data we're getting on vaping, and we're starting again now with vaping, and it's just really disappointing, and we don't know how we can implement a vape-free campus, because we've gone to a huge amount of work to tobacco-free campus, and we're monitoring who's smoking on campus. Vaping is a whole other animal, and it's breaking my heart. I'm not sure that what I've talked about is applicable to other institutions or to other health topics, but I'm happy to say what my learnings have been. Some of them include being open to learning. People never cease to amaze me. I love getting into a room with people from the whole campus because I can learn so much. So many times I had to change what I thought I knew based on the experience of, for example, a senior manager or a senior academic or a college meeting, or in a college meeting with students who were talked about their entirely different experience of smoking. I knew I wanted Trinity to be tobacco free, but I had no idea how we were going to get there. Having all of those people advise us, sometimes formally, sometimes informally, was just invaluable. I try to give everybody who comes to our meetings a job. I think that's a way of making them feel that it was worth their while attending, even though people are busy. The thing is just allowing people to define their own terms of engagement with the initiative. I will take any contribution people feel they can make, and I'm always grateful to get them. Another thing I've learned is to beware the echo chamber. I never know, is it better to work with people who are sceptical or people who are like-minded? I do think, though, it's good to get dissent up front. And while people in our group all supported the idea of being tobacco-free, there were members who thought it just couldn't be done. That was helpful because it focused our attention on barriers to success. So, for example, when we ran the pilot tobacco-free zones, we picked the most difficult areas in college to show we could make improvements. Having people in the group asking difficult questions meant we weren't blindsided in public by questions we couldn't answer. So having a bit of push and pull in the actual meeting meant that we felt much more prepared going into board. Another thing I learned is that health services are invaluable. So I am based in college health, and coming from the service was important because we could offer support to stop smoking. And we had to convey that this wasn't a thing to berate smokers with. It was trying to make it easier for people who want to be free of addiction to tobacco. Look, academics were absolutely invaluable. We'd have been sunk without data. Having prevalence data that showed only 8% of Trinity students smoked in 2013, having survey data to show support from students and staff, that gave us a mandate to do a consultation. Having town hall meetings and focus groups formally capturing the pros and cons of becoming tobacco-free gave us enough data to get permission for tobacco-free zones. Having students count the smokers in each of our pilot zone gave us enough data to show we could reduce smoking. And having campus-wide data shows that although we're imperfect, we're way further ahead than we were when we started. So the data, absolutely invaluable. Another thing that was invaluable was the students. Once TCD-SU came on board with becoming tobacco-free, the momentum for the project changed and we were able to become almost tobacco-free. Curriculum is, we've been able on occasion to set briefs in the curriculum. Academics facilitate that for us. For example, this year on vaping, we had 49 students who designed social marketing projects on vaping for us. And then the other thing is that we have been able to pull together this group of people who we write submissions to government. So for example, this year there were 2 submissions to government on vaping and disposable vaping, and we were able to use the imprimatur of the university. So we were say, well, this is Trinity's response. Because we had so many people involved in the project, we were able to get sign off from Trinity to respond to that government submission, and we called for a complete phase out of vaping. So it's good to be able to work at that kind of national level.